Johannes, you just asked if it was going to be recorded. I think the answer is yes. Oh, yes, it is being recorded now.
Yeah, of course.
Thank you. Thanks, Johannes.
You're welcome.
Hello, everyone. Just waiting for people to be let into the room. So we'll get started in 1 second. Okay, I think. Okay, welcome everyone. Thank you all for joining. Welcome to this third briefing webinar on the multi-stakeholder hearing that's hosted by the Coalition of Partnerships for UHC and Global Health. My name is Elisha Dungiorgio. I'm the President and CEO of Global Health Council, and I'll be moderating today's session. So today we have presentations and a question and answer session that will focus on sharing any new information on the multi-stakeholder hearings. In particular, we'll talk about logistics around statements, submissions, and publications and interventions from the floor. So before we get started, I just want to remind everyone that we do have interpretation for Spanish and French. If you need that, you can go to the bottom right corner of your Zoom window and you'll see a little globe titled interpretation. You can click that and select the language that you would like. Okay, so without further ado, I'm going to turn it to opening remarks from Dr. Karine Karima, the interim CEO of the RBM Partnership to End Malaria.
Good morning, everyone. First of all, I would like to thank the organizer for inviting me to provide the opening remarks to this coalition of partners event. And I would like to thank also the organizer of organizing this meeting this week. Tomorrow, it's the World Malaria Day. And this is very important for the RBM Partnership to End Malaria, as we highlight the need of urgent action for further investments to end malaria. First of all, I would like to tell you that the RBM Partnership to End Malaria joined the coalition and highlights and really appreciate being an active member of the coalition. And through the coalition together, we can intensify higher political level advocacy structure to enable member states as well as organizations to justify the percentage of GDP going to health, where it is spent, and show the impact it has generated. And this is what we really do at the RBM Partnership to End Malaria, to continue to keep malaria high on the global health and political agenda, and especially uses our voices, political capital and funding to keep that focus. And this will help us to accelerate our efforts to sustainably fund and implement effective program with the goal of investing not just for better malaria outcome, but to create a resilient health system that can deal with whatever the future brings. So thus the coalition should put emphasis on efficiency collection and use of data. This can only be achieved through the health system strengthening accountability, transparency, and good governance, as you know. The leave no one beyond strategy is really important to ensure that special emphasis is put on the power, the vulnerable and marginalized segments of the population. Of equal importance is strengthening human, community rights and gender while ensuring access to essential, safe and affordable health services, which do not impose financial hardship on the poor. In malaria, we explore and utilize opportunity for community participation. And as you know, health system radically reoriented towards primary healthcare are the backbone of successful response to malaria and other diseases. So more than 90% of essential health services can be delivered through primary healthcare, including many services to promote health, prevent disease, and avoid or delay the need for more costly secondary and tertiary care. So engaging communities in the response is really very important, and as they have great insights and experiential knowledge. So I strongly recommend that the coalition continue to encourage communities to be involved in decision making, and I really like this consultative event where everyone provides input, and it also explores tangible opportunities for resource mobilization, efficiency use of health resources in terms of where they are deployed, invested, and how effectively they are spent. So increased synergies, and we have seen that the COVID-19 pandemic has revealed that fragility of most health systems. So pandemic-related funding must have strong health system sovereignty components. And there is a need for the coalition to identify other potential non-participatory organizations to join hands with the coalition to strengthen a people-centered, multi-sectoral, participatory approach while mobilizing political leadership to increase and prioritize the health budgetary allocation and spending. Political leaders, countries, and partners should view the multi-sectorial lateral approach, global awareness, international solidarity, and international cooperation beyond health. So in conclusion, we from the malaria community are encouraging that the coalition continue to collectively work together by combining our organizational comparative advantages and strength toward transforming the future direction and sustainability of the coalition. So I thank you very much and wish you a fruitful meeting. Thank you.
Thank you so much, Dr. Karima. I think it's words we can all agree with. Next, we're going to move on to our panel presentation. We're going to walk through the program, concept notes, thematic areas, and also some of the logistics on statements. It's going to take us about 30 minutes, and after that, we'll have a Q&A period. So if you have questions as we're going through these presentations, please put them into the chat, and we'll get to them once everyone has completed their presentation. So I'm going to ask our panel first with Akihito Watabe, Program Manager and Coalition Working Group Coordinator from UHC 2030, Shema Karavila from WHO headquarters, and then we also will have Jessica Clark from WHO's New York office. I think Akihito, you are first up, so please take it away.
Thank you very much, Elijah. Let me update the coalition preparation for the high-level meeting, multi-stakeholder hearing. So this is a third session. So my presentation is the building on the previous last session's preparation, and we have more detailed updates from the WHO and also New York side. So next slide, please. And next slide, please. So first of all, this is a quick recap of the multi-stakeholder hearing on 8 and 9. The TB multi-stakeholder hearing will start afternoon of May, and this is the New York time, and then followed by pandemic preparedness and response, which is morning of 9 May. And then the last session will be the UHC, 9 May afternoon. So all the multi-stakeholder hearing will be 3 hours in total, including opening and 2 sessions, panel sessions, and then closing. That is a package of the 1 hearing, in total 1.5 day. And then the place, the venue of the meeting with Trustee Council Chamber, the United Nations headquarters in New York. And the registration has already closed, and the PGA has already sent the confirmation email to all approved participants from the UN Secretariat. So please use this confirmation email for visa application if you haven't done yet. And also, if you haven't received the confirmation email, also send the registration through the form, please also contact the PGA office focal point, which is included on the registration form. In terms of the expected outcomes, the President of General Assembly will summarize the hearing discussion. The 3 reports will be available after the multi-stakeholder hearing and circulated to member states, and also it's going to be public available on the PGA's website. And then also the co-facilitators of the high-level meeting, 3 high-level meeting processes will update the document to prepare the 0 draft of the political declarations. That should be available after the hearing. And we don't know yet the timing of the TB and PPL, but UHC political declaration 0 draft, the timeline is already set, and that is publicly available. So we will share the link of the milestones, but the 24th May is the timing that the UHC political declaration 0 draft will be presented publicly. In terms of the format, also the PGA shared the concept note and the program of the multi-stakeholder hearing end March. So we expect the 4 to 5 panelists per session. In total, around 9-10 per multi-stakeholder hearing, and also intervention from floor should be available. And also we expect the written statement arrangement should be also available. And the New York team will update this after the presentation from WHO. In terms of the theme, that's also theme and guiding questions on TB and PPL that's already included in the concept notes and the program of the hearing. And on UHC, and today the Shama from WHO will share with us the more detailed thematic areas of the UHC hearing. So that's a quick cross-cutting update from the coalition partnerships. And then let me handing over to Shama for the next update.
Thank you, Akihito. I just want to make a note that apparently the chat is disabled. So if you have a question, please use the Q&A icon at the bottom to put your question up. Thanks a lot. Over to you, Shama.
Thank you very much, Elisha. Thanks, Akihito. So UHC 2030 colleagues requested that I provide a brief update about the thematic areas of the UHC multi-stakeholder hearing session. And just to tell you, this is all breaking news because just the President of the General Assembly hasn't yet formally published this. So my colleague Jessica will say we were trying to figure out, can we actually share the themes and with everyone? And so we can. So you're the first to get the overview. So next slide, please, Susanna. So in my presentation, I'll broadly go through the provisional program. And then as Akihito discussed, there will be 2 main panels. The first one is about UHC as a driver to accelerate health for all. And the second is about UHC commitments and how they translate to action and accountabilities. Next slide, please. So in panel 1, we have the first one is about championing political leadership for universal health. And we know that the UHC high-level meeting, the main outcome is a political declaration. But politics is also about all stakeholders, the whole of society, and how this global movement leads up to that specific declaration, and then to its implementation and achieving UHC goals. Gender equality and equity overall are at the center of this agenda, ensuring that no one is left behind. One of WHO's evidence-based recommendations is that if the whole population cannot be covered by services, then that countries should focus on those who are being left behind, who are furthest left behind, the populations facing the greatest vulnerabilities. And in the health workforce and for those accessing services, gender equality needs to be ensured. That we move together towards UHC with the whole of society multi-stakeholder approach. We all have a role to play and we all have different responsibilities, as Justin Kuhn just mentioned in a previous discussion. And one thing that has been coming through is how the three high-level meetings are connected. How does UHC link to health emergencies and also to TB? And one of the strongest links is our evidence-based action on strengthening health systems, basing UHC on the integrative foundation of primary health care, which is a link to emergency preparedness through the multi-stakeholder engagement and essential public health functions like surveillance, and also to deliver services for better health and leave no one behind. As we said, equity is a common theme. Panel, so actually, yes, we just went through all of these. Thank you, Susanna. And maybe if we just go to the previous slide on equity. Yes, you can see that even within countries, especially within countries, you can see the difference between the highest and lowest quintiles in accessing, for example, services for women, children, and adolescents. Next slide. So panel 2 is about moving from commitment to actions and accountability that is people-centered. And so, Susanna, I'm just going to go through the themes. So the first is about invest more, but invest better. And the evidence all shows the importance of one national health plan and government spending on health. And you can see that if governments spend too little, the out-of-pocket expenditure contribution is very high. And there seems to be a wide range as well, even within governments that are spending at the same level, showing that what you invest in, the invest better matters, to achieve better results. Okay, next one. Reorienting health systems to primary healthcare, as we said, as a foundation, as a link between the three HLMs as well, to deliver on UHC, all health programs, emergency preparedness, and better health and well-being. Next. The health workforce is central to doing all of this. And we've just finished the 5th Global Health Workforce Forum, where there were very strong evidence-based strategies, commitments, and you can also see the shortage across different regions that really urgently need to be addressed. Next. And ultimately, it's about accountability to people, people as consumers of health services, people as voters, people as rights holders, most importantly. And there are different tracking mechanisms that would be referred to in terms of getting a sense of accountability towards progress. Next, please. So in terms of WHO support for the high-level meetings, and my colleague Jessica will talk shortly, we have a website where there are short technical briefs. They're not dense or technical, but more for a policy and multi-stakeholder audience. Please look at those. WHO technical departments are preparing talking points and the evidence support for the multi-stakeholder hearing and speakers to use as they find helpful. There will be technical focal points online to support Q&A or requests for references. And of course, we're working very closely with UHC 2030 and partners to support multi-stakeholder engagement, including just before this meeting, there was a pre-meeting for the World Health Assembly with member states and non-state actors. Next slide. So just to conclude again, to say we all have a role to play. There's information available on WHO and UHC 2030 websites, and we look forward to continued collaboration. So Elisha, back to you.
Thank you so much, Shema. I think next up we have Jessica, who's going to talk through some of the logistics on statements, and which is great because we do have a question about that. So Jessica, I'll turn to you.
Thanks, Elijah. Yeah, happy to answer, well, to share an overview of the logistical information that we have at this stage and to answer any other questions that may come up. As Akihito mentioned, the UN has now sent out all of the approvals for the hearing, so hopefully everyone online has received theirs. But just to mention that they will also be circulating additional information, hopefully later this week or early next week, with some of those details on collection of passes, submission of statements, etc. But I'll share a little bit of what we expect at this stage today. So for passes, everyone who is approved for the hearings will get a special event ticket issued in their name. So guests will need to bring their government issued ID, both to pick up the passes and to pass through the UN security screening on the day of the event. We're still finalizing the dates and times for ticket collection, but expect there will be at least 2 opportunities to pick up passes, likely one on the 8th and one on the 9th. On the statements, which I know is of great interest to the stakeholders, just a reminder that there will not be a predetermined list of speakers. And given the time constraints, there's, of course, unfortunately, no guarantee to intervene from the floor. But we do encourage those who are interested to submit their statements online through the Indico portal. This is the same registration page that was used to register to attend the meetings. So if you've registered, you have access to continue updating your registration up until the meeting, through the meeting, and we will likely leave this open for a couple of days after the meeting. So if you've submitted a statement already, you can update that going forward to the meeting. If you've not submitted one, you can do so through the meeting. And then, as we had done in the previous 2019 high-level meeting, these statements will then live or be housed online. Through the WHO webpage, we'll have more details on exactly where those will live as we get closer to the date. But these will be recorded online as a public record from the multi-stakeholder hearings. And then I also just want to go ahead and flag that, similar to the previous high-level meetings, there will also be an accreditation process for organizations that are not in consultative status with ECOSOC to attend the high-level meetings in September. So I know many of you are probably familiar with this from other health high-level meetings at the UN, and just want to flag that once the multi-stakeholder hearings conclude, we will start with this process. So more information on details that are needed and timeline for that process will be following shortly. I think that's all from my side for now, but again, if there's any other questions, feel free to put those in the Q&A, and I'll keep an eye on that and answer as much as I can. Thank you.
Thanks, Jessica. Maybe I can just bring you back to this question around the oral statements. So what you said, I believe, is that there's no predetermined list. Is there a point during the hearing when people will be called up, or what are the logistics exactly of this, just so we can get to this question?
So the run of show is still being finalized with the President of the General Assembly's office, but what we expect is there, as you know, there's 2 panel discussions, and we would expect that there would be an interactive piece. So you'd have formal panel and then interaction with the floor. And there will be more guidance on how exactly this will work, whether it's first come, first serve, pressing the microphone, or any other mechanism, but we don't have details on that to share yet. I do see the question about 2-minute statements, and just want to reiterate that 2 minutes, very brief statements, is what will be requested from those interacting from the floor.
Great, thank you so much. That, Jessica, was our last official presentation. So I see some other people are putting questions in the Q&A box. Please, if you have something you'd like our panelists to address, can you type in your question there and we'll try to get to it. I do see one additional question around statements of whether there is any length or guidance on the written statement. I don't know, Jessica, if that's to you, perhaps.
I think the information that will be circulated by the UN with some of these logistic details, we'll try to make that clear in the note that will go around then. But in terms of length, just a reminder that we're very tight on space. The hearings this year are only a half-day session, so the space for interaction from the floor will be quite limited. So 2 minutes or less, just to keep the statements very short, please.
Okay, and we did get another question from someone whose organization received approval to participate in the HLM and wants to know if there's a number of people who can participate from that organization. Is there a limit? How does that work? I'm not sure who this one goes to. I'm still looking at Jessica. I feel like all these questions are for you.
Yeah, this is actually a question for our colleagues in the UN Secretariat, DESA. I think that given the numbers of those who registered, we were within the capacity. So most, if not all, were approved. I don't know that there were any restrictions on numbers per organization, but for the high-level meeting in September, there will be. The space is much more restricted, of course, but we don't have any numbers on that yet. But for the hearing, I think most, if not all, of those who had applied were approved just based on capacity of the venue.
Okay. And I'm gonna, one more question for you, since this is about the submitted statements. It sounded like there would be an interactive session and that people could step up and say their statement. Is it only from those who have already been submitted that people are chosen, or is it going to be an open forum?
To be honest, this is a detail that we will need to clarify with the PGA's office and also UN Security and Protocol. There's still some of these logistical pieces of how the program will run that we don't have clarity on quite yet. But I will ask them to share as many details as possible when that additional information note comes out from the UN Secretariat on participation.
Okay, we're getting a lot of questions about the statements. So, and also whether written statements can be longer than sort of what would be required for an oral statement.
My suggestion would be to try to keep it to 2 minutes or less in what is submitted through the Indigo portal ahead of the hearing. But since the portal will remain open through the hearing itself, likely for a few days, they were talking about maybe even a week or so, this could always be updated. So if something was not able to be said in the 2 minutes that's allotted for an intervention from the floor, perhaps it could be then added in for to be included in the statements that'll then be housed online after the fact.
Okay, that's great. I think that was the last open question that I see. There was a question about where the agenda is available for the full program of multi-stakeholder hearings. And someone did answer that in the Q&A, but maybe Akihito, you could talk a little bit about that, where the agenda is, and maybe just walk through it again quickly.
So the program is already released by PGA last month. That is available. So unfortunately, this chat function is disabled, so we are not able to share the link. But we're gonna upload the direct link to the website. We summarize this webinar and also recorded video after the session. But the program is available, but that should be updated very soon. Based on the latest information, including the list of speakers and also key guiding questions. And also the UHC thematic area, just Shama presented, that should be also included in the updated version. of the concept note. And also the PJ already sent the invitation to all panelists. So those who received the invitations, please confirm your availability, and then also, share your role so that we are able to track and support on this. But PJ hasn't shared the list of speakers publicly.
Great, thank you. And another question about whether it's possible to listen to the hearing in May and whether you have to be registered or not. Will it be streamed?
Yeah, so this session will be live streamed and also recorded and then share through the UN TV. So you could access to the live discussion and also watch the recorded video after the event. But this is going to be one way, so live stream, but not interactive discussion with the online participants. Only in-person participants can be part of the interactive dialogue.
Okay, thank you, Akito. And then still some questions about registration and the number of people permitted in contrast to what was allowed at the 2016 HLM. Just some confusion about how many people can attend in person. I don't know, Jessica, if there's anything further you can say.
Yeah, I just want to clarify that we're talking about the hearing and not the high-level meeting in September. So for the hearing, it was a registration process for individuals. So it's name-specific tickets. So only those who have registered to attend and have gotten an approval to attend can come to the hearing. The accreditation process I was referring to is for the high-level meeting itself in September, and that is accreditation for organizations that are not in consultative status with ECOSOC. And the accreditation process is specific to individual meetings. So for those who applied for accreditation in 2019, organizations would have to do it again for the UHC meeting this year, same with tuberculosis and pandemic prevention, preparedness, and response. And then once the organization is approved, has accreditation approved, then individuals from that organization can register to attend the high-level meeting. So that's a bit of a different process. But speaking strictly on the hearing here today, it's individual specific tickets, and only those who registered and received an approval from the registration process will be able to attend. So the tickets can't be shared within an organization, let's say, because they're name specific, and you will need a government issued ID to collect it and then enter into the UN. I hope that clarifies, but let me know if any other questions.
Yeah, that was great. Thank you. And I think an important reminder that we're talking right now about the hearings and not about the September meetings, right? I don't see any other questions in here. So I want to just turn back to our all of our panelists and just check and see if there's anything after hearing these questions that you wanted to add. Akito, did you come?
Sorry. There are a few questions that we didn't answer in previous session, so maybe that will be available on the Q&A list that we are now identifying some remaining questions. Do you have any questions?
So I'm looking through the list of questions. Many of them have been answered in the Q&A. We had quite a few questions about the statement procedure, how panelists are chosen, whether or not this meeting will be available and the recording will be available. Again, we can't put that in the chat, unfortunately. I don't see others in here. Let me see. There's a new question about whether there's a list of unofficial side events that's available. And I know sometimes that's posted on the DESA site, sometimes that's posted on the...
Yes, so the list of, let me answer this question. So there are a few official side events during the hearing or after the hearing. So we are going to post the information on the website if it's publicly available. So that should be also available on the US Citizens ID website at least. We expect one debriefing session after the hearing for all participants in the hearing across the 3 sessions that's planned. And also there are some lunch or dinner events that are organized by partners. So that's still waiting for the confirmation of some arrangements, but that the list should be available on the event page of the UHC 2030 at least.
Okay. And I think Jessica, you answered this earlier, but just can you remind us of the process for picking up passes? I think you said there would be 2 time windows to be determined.
Yeah, we're still working out the timing and location for picking up passes, but we expect there will be 2 opportunities, one on May 8th and one on May 9th. But the UN will circulate this information and probably 1 or 2 more emails from the same account that sent the approval of registration. Will follow more information and logistical details closer to the date.
Okay, that's great. And we have a question.
On this, just for the clarification on this, this is not the ground pass, that is event pass for the specific event, right? So
yes, for the hearings.
UN,
yes, not the
UN ground pass.
No.
So that's,
I think we're all just using shorthand here.
Yeah.
The pass.
No one will be getting UN grounds passes for this.
So this is a specific event pass for the specific session, not
you don't have to
the
have a
access
grounds
to
pass.
the UN. So that's requires some protocols and escorting.
Yes, thank you, Akito. There is a question here about member state participation and what we anticipate that will look like. Will member states be taking the floor at the hearings, or will they be mostly listening? They have other sessions and opportunities to provide input. So how do we anticipate them to show up at these hearings?
Yeah, I can respond to this one. Member states have been encouraged to attend, also at high level, which was specified in the modalities for the high level meeting and the hearings. I think that there is quite a bit of interest from member states, but they've also been encouraged to be in listening mode and primarily give the floor to other stakeholders. Doesn't mean that they won't also request the floor, but the platform is primarily to prioritize other stakeholders and member states to come and listen and then take that feedback into negotiations later.
Okay, thank you. Any more questions? So just while we're waiting for more questions to come in, I just want to make sure to recap where we are on logistics, because I think most of the questions here have been around logistics. So just a reminder that we're talking about the hearings and processes around hearings, which is a special event. And that, as Jessica has said, this is registration is by person and event pass is by person. So when the time comes when there's a block to pick up your event pass, you need your ID, and you can't switch those in between organizations. It's a by person pass. We're still waiting to get some more information about statements during the hearings, and then that will come sometime soon. We don't. Do we have a timeline for when that will come, Jessica, do you think?
No, the only thing I can say is that we have a broader coordination with all the relevant UN departments later this week. So that's security, protocol, the President of the General Assembly's office. And this is on the list of things to discuss, just logistically how that will work out in the program. So we'll try to get as much information to everyone as quickly as possible.
Okay, great. And I think there were a few asks in the Q&A for links to both the program as well as the side events. So when this recording is shared, I think those can be shared as well. Akihito, I see your hand is up.
Yes, this is more substance of the hearing. So as Shama from WHO shared the thematic areas of the UHC hearing. And of course, the TB and PPL that's already available on the concept note of the hearing. Please do consult this key guiding question, the thematic area, when you prepare the statements, because your statement should be somehow in line with the direction of the discussion for the hearing. That's important to defer these key guiding question or thematic areas. And also we do encourage the joint statement instead of individual because speaking slot is very limited, and based on the experience from last hearing, that's always group statements or joint statements from the network or the coalition or constituency that is more likely to select it. And of course, we don't know the selection criteria yet, but that we do always encourage the joint statements during the hearing.
Thank you, Akihito. Jessica, I see your hand up as well.
Yeah, I just wanted to add, I see Letitia has shared the concept note and program in the chat, and just to add that the President of the General Assembly is also working to set up a web page for the multi-stakeholder hearings. So that will be on the President of the General Assembly's main page under events. We hope that will be up in the next week or so, but more information will then be populated and updated on that page as well. So to check back for that as an additional resource.
Great. And while I have you here unmuted, there's one more question trying to clarify about the opportunities to speak, which I'm not sure if we have right now, but I just want to make sure we raise it. And to clarify this question, the opportunity for attendees to speak, is it strictly from the floor and not predetermined? And then the 4 to 5 panelists are not from the participants.
Yes, so the panelists, a bit of a more formal part of the program, were selected by the President of the General Assembly's office with inputs from other stakeholders and WHO. There will not be a predetermined list of interventions from the floor. As Akihito said, we are still working to define the selection criteria of these with the President of the General Assembly's office, but they're very adamant that this will be a truly interactive portion of the program. And so as soon as we have more information on logistics around that, we will certainly share it. But these are 2 separate pieces. So panelists have already been selected, and interventions from the floor will be an interactive piece from the room.
Thank you. Okay, and then a question, maybe either for Akihito or Shema, around the zero draft and what that will look like in terms of how it addresses gaps from 2019, meeting the commitments, further actions, etc. And also, should we be providing direct inputs in our statements? I'm not sure, Shema, maybe you could start us with that.
Thanks, Elisha, and then colleagues can contribute as well. Just to say that we've had, well, through UHC 2030, the broad multi-stakeholder consultations on the action agenda, and similarly with WHO and partner agencies as well as reviews of evidence and data. So in the World Health Assembly governing bodies documents, the UN Secretary General's UHC Progress Report, you'll see a lot of these, and the State of Commitments report from UHC 2030, a lot of the inputs already provided by all partners that have been synthesized into some clear action points. And so these are all inputs to member states. And in a way, these are all elements to member states starting to develop their zero draft. And Jessica can, I think the timeline has been put in the chat as well, and Jessica can advise, but all these elements go to member states. And I think May, June, there will be the zero draft. I just had one thought on the written statements and on the statements from the floor, is that it's the mandate for this particular high-level meeting is that there is a concise, action-oriented